Has your dog been drinking more water than usual? This might not just be heat, and ignoring this sign could be costly. The kidneys are vital organs that work silently, filtering toxins and keeping your dog healthy. When they fail, the signs can be subtle at first, but the consequences are serious. The good news is that you can learn to identify the early warnings and act quickly. In this video, we will explore the 7 most important signs that indicate kidney problems in dogs, plus the risk factors that every owner should know. Before we begin, please leave your name and the city where you're watching our content in the comments. The kidneys are true treatment stations of the canine organism. They filter blood continuously, removing toxins and waste that would be harmful if they remained in the body. Additionally, they control fluid balance, regulate blood pressure, and produce hormones essential for red blood cell formation. When the kidneys begin to fail, this entire delicate system collapses. Toxins accumulate in the blood, fluids become dysregulated, and the animal's body enters a state of gradual intoxication. What's most concerning is that kidney diseases are silent. Unlike other health problems that manifest quickly, the kidneys can lose up to 70% of their function before evident symptoms appear. Therefore, knowing the early signs can make all the difference between successful treatment and irreversible complications. Sign 1. Excessive thirst and large amounts of urine. When the kidneys cannot filter adequately, the body tries to compensate by eliminating toxins through increased urine production. This creates a cycle where the dog needs to drink more water to replace what it's losing. You may notice that the water bowl needs to be refilled more frequently, or that the pee pad gets soaked quickly. The urine also tends to become clearer and without strong odor as it is diluted. Observe if your dog wakes up during the night asking to go out, or if it starts urinating in inappropriate places, even though it's well trained. This behavior may indicate that it simply cannot hold it for very long. Some owners confuse this sign with summer heat or increased physical activity, but if excessive thirst persists for more than 2 days without apparent cause, it's time to investigate. Also monitor the frequency of trips to the water bowl. A healthy dog drinks approximately 1.7 fluid ounces of water per pound of body weight per day. If this volume doubles without clear reason, it may be an important alert that should not be ignored. Sign 2. Loss of appetite. The accumulation of toxins in the blood known as uremia causes constant nausea and a general feeling of malaise. Imagine how you feel when you're nauseous with no desire to eat anything. This is exactly what happens to your dog when the kidneys don't function properly. Initially, it may only show less interest in food, perhaps leaving leftovers in the bowl or taking longer to finish the meal. Over time, it may completely refuse food, even favorite treats. This loss of appetite frequently leads to rapid and visible weight loss. To differentiate from simple stubbornness or food selectivity, observe other behaviors. A dog that is just being stubborn still shows interest in food, smells the bowl, may even lick, but chooses not to eat. A dog with kidney problems simply ignores the food as if it doesn't exist. If food refusal lasts more than 24 hours in an adult dog or 12 hours in puppies and seniors, seek veterinary guidance. The associated weight loss can be dramatic, especially in more advanced cases. Sign 3. Recurrent vomiting and nausea. When the kidneys fail, urea accumulates in the blood at toxic levels. This substance irritates the digestive system, causing frequent episodes of vomiting and nausea. Unlike occasional vomiting from eating something inappropriate, vomiting related to kidney problems is persistent and may have specific characteristics. The vomit may have a particularly strong and unpleasant smell, and the animal's mouth also develops a characteristic odor. In initial phases, episodes may be sporadic, perhaps once or twice a week. As the condition progresses, they become more frequent and may include only yellow bile or white foam. The animal may also show signs of nausea even without vomiting, such as excessive salivation, repeatedly swallowing, or showing abdominal discomfort. It's important to distinguish between isolated vomiting and a recurrent pattern. If your dog vomits more than twice in 48 hours without having ingested something suspicious, consider this a warning sign. The combination of vomiting with other symptoms from this list significantly increases the probability of kidney involvement and requires urgent veterinary evaluation. Sign 4. Bad breath and mouth ulcers. Uremic breath is one of the most characteristic signs of advanced kidney problems. It has a peculiar odor, frequently described as smelling like ammonia or rotten fish, completely different from normal dog breath. This happens because nitrogen compounds that should be filtered by the kidneys accumulate in the blood and are partially eliminated through breathing. Besides the odor, small ulcers may appear on the gums, tongue, and inside of the cheeks. These wounds result from irritation caused by toxins and can be quite painful, contributing even more to loss of appetite. The ulcers begin as small red spots that evolve into open wounds with white or yellowish edges. The animal may show pain when chewing or even when opening its mouth. This sign usually appears in more advanced stages of kidney disease, when toxin levels are already significantly elevated. If you notice changes in your dog's breath, especially if accompanied by mouth sores, don't wait for it to improve on its own. This is a serious indicator that demands immediate veterinary attention to prevent further deterioration of kidney function. Sign 5. Tiredness or weakness. The kidneys produce a hormone called erythropoietin responsible for stimulating bone marrow to produce red blood cells. When kidney function decreases, production of this hormone drops drastically, resulting in anemia. Fewer red blood cells means less oxygen being transported through the body, causing generalized fatigue and weakness. You may notice that your dog, previously playful and active, now prefers to lie down. It may avoid climbing stairs, show reluctance for long walks, or simply seem less interested in activities that previously excited it. This behavioral change is gradual and can easily be attributed to aging, especially in older dogs. That's why it's important to compare with the animal's usual behavior. A dog that has always been active and suddenly becomes apathetic is signaling something wrong. Weakness may also manifest as muscle tremors, difficulty getting up after rest periods, or need for frequent breaks during normal activities. If these changes persist for more than a week, especially when combined with other signs from this list, a veterinary evaluation is recommended to investigate possible underlying causes. Sign 6. Swelling in paws or abdomen. When the kidneys cannot adequately regulate body fluids, fluid retention occurs, which manifests as swelling, especially in the extremities and abdomen. This edema usually begins subtly in the paws, making them slightly more voluminous than normal. Over time, it may progress to abdominal swelling, giving the dog a pot-bellied appearance. To identify this swelling in daily life, gently press the animal's paw with your finger. If a mark remains that takes several seconds to disappear, this indicates fluid retention. The swollen abdomen may be confused with weight gain or gas, but has distinct characteristics. While weight gain is gradual and uniform, edema develops more quickly and has different consistency to touch. The abdomen with fluid retention appears distended and may even make a wave sound when gently shaken. This sign can be especially deceiving because some owners interpret abdominal swelling as a sign that the dog is eating well and gaining weight. In reality, it may be exactly the opposite. an indicator that the body is retaining fluids due to failure in kidney filtration and elimination function. Sign 7. Hair loss. The relationship between kidney function and skin health is closer than many imagine. When kidneys fail, toxin elimination becomes compromised, and the body tries to compensate by eliminating waste through the skin. This results in irritation, dryness, and eventual hair loss. Additionally, poor nutrient absorption caused by kidney problems directly affects hair and skin quality. The first signs include duller hair without shine that breaks easily. The animal may develop excessive dandruff, and the skin may appear dry or scaly. Hair loss is usually not uniform, creating thinner areas or even bald spots, especially on the abdomen and sides of the body. This process can be gradual, becoming more evident during brushing, when you notice much more hair on the brush than usual. The skin may also develop a characteristic odor, resulting from toxins being eliminated through pores. Although hair loss can have many causes, when combined with other kidney symptoms, it becomes a late but significant indicator. That's why it's important not to treat just the dermatological symptom, but to investigate possible systemic causes that may be affecting the animal's general health. Some factors significantly increase the chances of a dog developing kidney problems. Advanced age is the main risk factor, with dogs over 7 years being more susceptible. This happens because kidneys, like any organ, suffer natural wear over time. Diet also plays a crucial role. Poor nutrition, excess low-quality protein, or diets very rich in phosphorus can overload the kidneys over time. Dogs that regularly consume human food, especially processed foods with high sodium content, have elevated risk. Medical history is another important factor. Recurrent urinary infections, kidney stone formation, prolonged use of certain medications, uncontrolled diabetes, and arterial hypertension can gradually damage the kidneys. Chronic dehydration, common in animals that drink little water or live in very hot climates without adequate access to fresh water, also contributes to kidney problems. Exposure to environmental toxins such as cleaning products, pesticides, or toxic plants can cause acute or chronic damage. If your dog fits into any of these risk factors, regular preventive exams are even more important to detect problems early. What to do when noticing these signs? If you identified one or more of these signs in your dog, don't wait to seek veterinary help. Kidney problems progress quickly, and early diagnosis can make the difference between successful treatment and irreversible complications. During the consultation, provide detailed information about when symptoms began, their frequency and intensity. The veterinarian will likely request blood tests to evaluate levels of urea, creatinine, and other substances that indicate kidney function. Urine tests are also fundamental to check for presence of proteins, blood, or other abnormalities. In some cases, imaging exams like ultrasound may be necessary to visualize kidney structure. Treatment options vary according to disease stage. In initial cases, dietary changes may be sufficient, using specific foods for kidney function with high-quality proteins and controlled phosphorus levels. Fluid therapy may be necessary to help kidneys eliminate toxins. Medications to control nausea, stimulate appetite, or treat secondary complications may also be prescribed. The important thing is to remember that although kidney problems are serious, many dogs can live with quality for years when diagnosis is made early and adequate treatment is followed rigorously. Now, you know the main warning signs for kidney problems in dogs. Remember that your attentive observation can save your companion's life. If you noticed any of these symptoms, don't hesitate to seek veterinary guidance. Did you like this information? Leave your like, subscribe to the channel, and share this knowledge with other owners. Your dog thanks you for always being attentive to its health.